Welcome, everyone. Welcome to this month's edition of Lean In Olympia. I'm so glad you're here. Lean In Olympia is a bi-monthly or monthly podcast I host every other month. So it's a monthly podcast from Interfaith Works. We are a social justice nonprofit serving Thurston County here in Washington. We're celebrating our 50th year of service to the community. I'm so glad you're here. My name is Corey Passons. I'm the Director of Interfaith Relations with Interfaith Works. We're a coalition of 30 plus faith-based communities and affiliated organizations, and we're also one of the region's largest social service providers to vulnerable adults experiencing homelessness. As I said, this is Lean In Olympia. This is a podcast in audio and also audiovisual that goes across all of our social media websites. You can check us out on YouTube, Spotify, Apple Podcasts, and don't forget to subscribe and follow so you never miss a new episode. And check out our website at interfaith-works.org or find us on Facebook to stay up to date with what's going on. So I host every other month, and my co-host is Meg Martin, who is a social worker and also does episodes that typically focus on public policy and homelessness. Meg and I were going to co-host today, but Meg had a conflict. We both attended a workshop that our guest Kevin Nye offered here in Olympia a couple years ago, and we became familiar with your book, Grace Can Lead Us Home: A Christian Call to End Homelessness. And this is a book from 2022. We're going to talk a lot about the book today. And Kevin also has a new book that he's working on. We'd like to hear about that. But I just want to give a brief introduction to our listeners of you, Kevin. You're joining us from Minneapolis, yeah?
Yes, that's right.
All right, welcome. So Kevin Nye is a writer and advocate working towards ending homelessness by engaging best practices. He has written on the intersections of homelessness and faith for Religion News Service, Sojourners, Red Letter Christians, and more. He's presented at national conferences on the topic of homelessness, including Housing First Partners Conference in 2022. Kevin's first book, which I just held up, was released in August of 2022. It's called Grace Can Lead Us Home: A Christian Call to End Homelessness. You can find it online. And Kevin currently lives with his wife and son in Minneapolis, where he works as housing director at an organization addressing youth homelessness. And then just briefly about the book, Grace Can Lead Us Home. We're going to spend more time talking about this, but this is reporting back stories, experiences, and education that Kevin has received in his time working in homeless services. Kevin shares about his theological training and how this training is a lens for those he has met in tents, shelters, and drop-in centers. The book explores the concept of grace and is written as a call to those who walk in the Christian tradition to examine merit-based systems of inclusion or exclusion that impact outcomes of how people experience the many different offerings of homeless services. So we'll spend time talking about that today, but thank you for joining us, and congratulations on nearly completing your next book. What is it?
Yeah, thanks. I'm glad to be here. I'm literally so close to completing, the first round of the manuscript for the book. I don't know if I'm able to reveal the title yet. It's
okay.
Been recently solidified, but I don't know if it's public quite yet.
Uh-huh.
Not that it's any kind of huge mystery or anything, but the second book is sort of taking what I established in the first book as sort of ideas and principles and ways of thinking and ways of transforming our hearts around what homelessness is, and putting it into practice. Specifically, what people of faith, what communities of faith are doing in the realm of homelessness in this country, for better and for worse. Examples. Predominantly, the book is about what's going right. Churches and organizations and individuals that are doing amazing stuff. And there's also an inherent contrast to those who are doing work in the homelessness sector from a faith-based lens, but who may be going about it ways that might be more harmful than helpful. So that's sort of what the book is about, is really taking that call that I talk about in the first book and getting it right.
Okay. Look forward to that, and congratulations on completing the manuscript, or nearly completing the manuscript, and I will be.
Got some footnotes to still,
Oh, you're so
massage a
close.
little bit. Yeah.
Okay, well, I'll look forward to reading it. I really enjoyed. I've read your first book a couple of times. It's been a very helpful kind of intersection of ideas to talk with people about homelessness and about concepts that in our popular culture, which can sometimes, like you said, be actually harmful when they actually people think that they're being helpful or wanting to be helpful, but maybe not achieving that. I want to just step back a little bit and understand you a little bit. How did you, as you come to this work, I want to ask you if you could share where you're from and just some of your background growing up, maybe some of the ways that you experienced religion in your early life. And so if you could just share with us what you would like about coming up and where you're from, that'd be great.
Absolutely. Yeah. So I grew up in Tempe, Arizona, born and raised there. I grew up in a denomination called the Church of the Nazarene.
Mm-hmm.
That is, from my earliest memories all the way through to attending a Nazarene college in Oklahoma City. That was my denomination. Fairly conservative, evangelical, not hyper conservative, but certainly in that conservative evangelical space.
Mm-hmm.
Around the time that I was in college and getting exposed to more scholarship on theology, on the Bible, I think my understanding widened. That kind of continued into seminary. I went to seminary at Fuller,
Mm-hmm.
which is more ecumenical, not denominationally specific. And that's sort of the trajectory that my faith journey took.
Mm-hmm. Towards deepening your connection with your own tradition.
Yes and no.
Uh-huh.
I would say that my denominational affiliation changed a little bit after seminary, where
Mm-hmm.
and not necessarily by choice.
Mm-hmm.
The denomination as that I was pursuing ordination in, the Church of the Nazarene, we sort of came to a head on some theological differences that were specifically around LGBTQ
Mm-hmm.
issues and affirmation, where I was at with that versus where
Mm-hmm.
the denomination was at, led to that separation. That it's not one with animosity. I still
Mm-hmm.
maintain relationships, but I don't attend or am involved in a Church of the Nazarene at this point.
Mm-hmm. As you think about where you are now in your work, and when you look back, are there any mentors or examples that you encountered back in your formative years that you can look back to and kind of credit with some of the ways that you were influenced or began to think in ways that brought you to where you are now?
Oh, absolutely. I think to some of the youth pastors and youth leaders that I had, and who, nowadays I might disagree on some things and the ways that I've changed and they've changed, but at the time who just really, really emphasize the need to understand God as love, and to really think past getting doctrine right or living up to some standard of rules, rather than just emphasizing, at that time, a relationship, and a relationship that's dictated by like love and forgiveness and grace. And I think that kind of set me on the right trajectory, I think, within a evangelical space that could sometimes overemphasize judgment, overemphasize excuse me, overemphasize rules and
Mm-hmm.
adherence and dogma, and then when I got to college, there's particular professors that really then steered that toward, the heart of God being for the vulnerable and for social justice, pointing me towards authors like Walter Brueggemann, who passed away a week ago, that, just really led me in different directions, opened me to different perspectives, and definitely wouldn't be where I am without so many of them.
Yeah, and that opening you're talking about, that emerging into new areas of thinking and being, can be an exhilarating and also a terrifying experience. In terms of our sense of belonging in traditions, for example, even with family. Did you ever experience that both and of the exhilarating thrill of becoming, or kind of emerging, of finding a sense of resonance with core values, and also a sense of maybe even, let's just call it, terror of how you might situate with people within a tradition that you've known?
Oh, absolutely. It's led to so many hard conversations with family, and when it did come down to that issue with the denomination, it was a lot more complex than they just said you have to leave. It was more like, if this is what you believe, then this is what would happen, and it kind of left the ball in my court to decide what to do about it, which then just led to a lot of weighing of the different options that I had, whether to stay and try to kind of fit into something that had decided that I didn't fit, or whether to leave but then bear the sort of responsibility of being the one who walked away. And so that was a season of, I like the word you use, terror. Maybe dread feels a little bit closer to that, and then having to articulate that decision to other people who cared about me and who had invested a lot in what their image of me was, that for a long time I had lived up to, and the path that they had hoped that I was taking, that I thought I was taking until I wasn't. So yeah, I experienced all of that.
I was talking with Meg today actually about this interview, and I was saying that this book probably wouldn't exist if you hadn't gone through the theological training that you did, and I'm grateful for that. And also there was a little boomerang at the very end of your theological training, where you were on, at least if I read the book correctly, you were on track toward what's called parish ministry, or working in a congregation. And then there was a sort of a diversion towards the end of your training, where you started to do some field work and were brought to proximity with homeless services. And then from there, how about you complete the story for us, or even fill in the gaps of what I started to talk about there?
Yeah, I think it's if it is a boomerang, it's one that got thrown around a couple times, where I really thought until even after I graduated seminary that I was headed toward traditional kind of parish ministry. But during both my undergrad and seminary, both times in the internships I had to do, I ended up at places that worked with people experiencing homelessness. And one of those was by accident, and one of those was kind of by accident. And it was more of a convenience than anything. But it was one of those things where you look back and you see, oh, I was headed down this path this whole time, and I didn't even realize it. Where in undergrad, I was interning at a church that it was one of those churches that is sort of a homeless ministry masquerading as a church. Like they sort of threw together a worship service every Sunday, but the real life of the church was the rest of the week, and the meals that they were providing, and all of that. And then in seminary, the church that I wanted to attend, and I also had this interim stint where I was a high-end barista, and this church had a a ministry that was um, a coffee shop ministry teaching young people experiencing homelessness the skills on how to work in a coffee shop. And so I was like, oh, I can do a church internship and combine that I want to work in a church and I know how to train people on how to make coffee. So it was
Mm-hmm.
one of those like, oh, let's combine all these things. And the homelessness piece was the last thing on my mind that then ended up becoming the trajectory of my life. And so really the switch over happened when I recognized that things with my denomination were not going in the direction that was going to lead to me taking a pastoral job anytime soon.
Mm-hmm.
And I was sick of working in coffee shops.
Mm-hmm.
And so I thought, okay, well, what can I do for work that feels meaningful, that feels like it brings my passion and what I feel is my calling to bear? If it's not going to be in a church, I feel like it should be in homelessness. And that just like suddenly felt obvious and right. And so I took the first job that made sense, and kind of the rest is history.
Mm-hmm. So you're talking about your calling is what you felt like you still stayed consistent to, but it was just a different expression,
Yeah.
not one that you had necessarily planned on.
Yeah.
Uh-huh. Okay, so then I just want to name that you did complete seminary,
Mm-hmm.
and you're now entering into homeless services after your seminary training is completed. In seminary, you would study various concepts, and one of them apparently stuck with you, which is this concept of grace. And I want to do two things. I want you to help us to understand this concept, and I also want to recognize that for many viewers today, they might not walk in the same tradition as you do, which is the Christian tradition. But I want to talk about why it's important to think about and to name this concept of grace, and why it's important to name the impact of the culture of Christianity in our country today. And so let me just set that up
Sure.
first, and then we'll turn back to you to talk about how you understand grace and see this relationship here. Currently, in this U.S. Congress in 2025 in Washington, D.C., 90% of the people who compose the current Congress, which is the House of Representatives and the Congress, the senators, including the executive branch, they identify as Christian or Catholic, 90%. And as a side note, 72% of Congress are people who identify as male. So I want to just appreciate that we, as viewers today, will have a wide diversity of perspectives and beliefs in terms of religion, spirituality, and Interfaith Works. We're an interfaith organization and coalition. We're recognizing this percentage of influence in the Congress because the public policies that come out of these institutions are just influenced by the persons who are there. So as we're having this conversation today, and as we're spending time with terms that are perhaps maybe specific to a one tradition, in this case Christianity, I just wanted to name the context of influence and why it's important to recognize that. Also, a side note, it's interesting that approximately 63% of the U.S. population identifies as Christian or Catholic, whereas 90% of the population in the U.S. Congress is composed of people who are Christian. So I'm just naming that as a way to remember the outsized influence of this tradition in our public policy that influences millions of people experiencing homelessness.
Yeah, and I appreciate you saying that, because it's something that I get asked sometimes, like why write a book just to Christians, and my professional work day to day in the homeless services sector is not faith based work. It's secular nonprofits, right? And I think what I came back to is, obviously that's the tradition I come from, and so it's the language I speak. But it's also the folks that I feel I need to talk to, right? That I think need to understand this better, and that I feel uniquely uniquely positioned to translate to and to speak
Mm-hmm.
to in a language that they can understand, because I speak that language fluently.
Mm-hmm. Mm-hmm. Yeah. Thanks for that. Because, like I said to the listeners today who are, even who are maybe outside the tradition or within this tradition, I hope that you'll appreciate the way that you can get some insight into some of the culture that's influential towards social policies that have real impact on human beings. And in Interfaith Works, we are, by our nonprofit status, a faith-based organization, but our social services are offered all without any implication of religiosity whatsoever. And the interfaith relations work that I do in the organization is separate from the homeless services aspect of the organization. And I'll talk a little bit more about some of the ways I saw the way the policies of Interfaith Works reflected in some of the best practices that you talk about in your book. So thanks for helping me to name that importance for having an understanding discussion around the implications of Christianity as an influence in our culture, even though this show doesn't necessitate a sense of belonging or identification in that at all to have this conversation be relevant.
Yeah.
So you went to seminary, and then it's pretty clear that a concept of grace kind of stuck with you at some level or other. And in your book, you point back to this this figure, John Wesley, and you name this founder of Methodism. And he names grace as this concept called free, undeserved favor.
Yeah.
And this is the source of grace, even though there's other definitions you could have chosen for this. Tell us more about this, and tell us how this understanding of grace that you had eventually became something that actually was working as an adjutant for you to want to speak to the tradition that offered you this concept of grace.
Yeah, absolutely. So, I mean, the more I've explored it and focused a lot of my work around it, the more I think that grace is the most fundamental Christian concept, right? Not to the exclusion of other religions, but to the extent that a core Christian belief about who God is, especially as seen in Jesus, is this idea that the way that God has chosen to deal with us is not through our own merit, is not through what we've done or how good we are or anything that earns that, but that it's based solely out of the character of God, which is defined by love, revealed to us in Jesus, right? And if that is true, that is it has implications for everything, and for those of us who ascribe to that belief and who see in God or in Jesus something to emulate, then that calls us to treat one another in ways that subvert categories of deservedness, right? Our culture, I think especially a Western American culture, really likes to deal in deservedness, right? Likes to quantify, qualitate, quantitate, monetize, evaluate our worth by what we can produce, by all kinds of different metrics that then rank us, evaluate us, and ultimately project our destiny, right? And so for me, the concept of grace is probably the most countercultural idea. And when it came time to, so I had this idea to write this book about homelessness and two people of faith for several years, right? And a lot of what that meant was I was, excuse me.
Yeah.
A a lot of what that meant was that I was, writing down stories as they
Mm-hmm.
happened, and like,
Mm-hmm.
this is a perfect story that illustrates this point. And I
Mm-hmm.
knew I had to have a whole chapter about this topic and this topic, but I didn't know what the book was about, right, as a whole,
Mm-hmm. Mm-hmm.
until it clicked with me, because of a study that I read that I quote all the time, and it's in the book, where the Washington Post and Kaiser Foundation found that Christians were more than twice as likely as non-Christians to blame poverty on lack of effort as opposed to unfortunate circumstances.
Mm-hmm.
And when I read that, it's like it all clicked at once. Like, oh, this is about grace, right? And this is about people of faith who are understand themselves as recipients of grace, but aren't then extenders of grace when it comes to people who are poor and people who are experiencing homelessness.
Yeah, thank you for let's kind of pause on that data for a second, because it
Yeah,
is it's something that I think it's pretty mind-boggling when you think about it, as someone like yourself and myself who are embedded in the tradition, trained in the tradition, to see some data coming toward us that actually shows us who we are. And so let's just say it again. In your book, you note that data points towards Christians being more than twice as likely, more than, as what you say in the book, and I'm not sure how the exact numbers are, but more than twice as likely as non-Christians to associate poverty with a lack of effort as opposed to difficult circumstances. And I'm wondering, how did we get here? How do you account for that? Is it someone who, let's say you meet someone on the bus, or on the street, who is in a different tradition than you are, and they would say, "How is that possible?" What would you say to them? Where would you point? What story would you tell?
that's such a good question, and it's a history that I've spent a decent amount of time studying for this next book uh, that I'm working on. And there's no real one way to pinpoint it down. I think that a key piece of it comes uh, from the revivalist era, that the sort of evangelical revivalist moment coincides with the birth of prosperity theology, right? That and prosperity theology is this strain of theology that I think we think is very niche, but has really infected a lot more than we give it credit for. This idea that um, wealth is God's blessing, right? That if you love God, if you follow, if you do the right things, then God will bless you with prosperity. Maybe not huge amounts of wealth, but at least comfort, and material material comforts and wealth. And what doesn't as much often get said is that the flip side of that would also then be true. That um, if you are a
Mm-hmm.
person who doesn't do the right thing, who um, sins, who doesn't lead a upstanding lifestyle, then the natural punishment of that, which God would ordain, is poverty, is homelessness, right?
Mm-hmm.
Um, and to the extent that I think you can look at a lot of um, revivalist preachers who are very famous for their more like revivally type messages, who were
Mm-hmm.
also saying a lot of these prosperity things. And a good example of that is Dwight L. Moody, one of the most famous revivalist preachers of that era. He's got Bible colleges and presses named after him, right?
Mm-hmm.
Moody Press, Moody Bible College, and
Mm-hmm.
um, he was quoted as saying, um, "Show me, show me any rich man, and I'll show you um, a follower of God."
Mm-hmm.
I'm getting the quote wrong
Mm-hmm.
precisely, but um, this was just a heavily influential idea around the mid uh, 1800s to the mid
Mm-hmm.
1900s,
Mm-hmm.
that really came to define American evangelicalism.
Mm-hmm.
That again we think of as more of an aberration of like a Joel Osteen, um, but is actually it's way deeper in us than that.
Mm-hmm.
And I think
Yeah.
that the ways that it comes out most often is in how we relate to poverty, because it's a
Mm-hmm.
very convenient way um, of passing on blame and then by extension passing on responsibility to do something about it.
Mm-hmm.
That
Yeah.
it's very convenient to believe that it's their fault and it's God's will that they're experiencing the consequences of their own actions, because then it frees me from feeling a responsibility to take care of my neighbor.
Yeah, and I'd like to just spend a little more time here talking about what some of the origins, because I think that it's important to try to unpack that. And I'd like to try to help with like
Mm-hmm.
adding on if you're open to that.
Please,
You know,
yeah.
and because I work from I'm ordained in the tradition called the United Church of Christ, which is a multi-stream Protestant denomination, one of which is Congregationalists. And the Congregationalists, those of you listening might be familiar with this in terms of people who really were seeking a political exile from England as the Puritans, and they were looking for religious freedom. Ironically, free from kings who are usurping their religious autonomy, and they were coming to this place, the New World, which is now currently the United States of America. You could call it Turtle Island through an indigenous lens. And some of the theologies they were bringing were this sense of agency. And not only were they bringing a sense of agency, they were coming to a place that had been ravished through plague, through the decimation. Indigenous peoples had suffered intense disease and death through sometimes the intentional distribution of plagues in their land. And when they arrived and came to this place, they brought with them a sense of they had a kind of spiritual recognition that has really been baked into the sense of American exceptionalists, and through the narrative that I'll say that I learned in my public schooling education, was that there was this coming to this place and having this sense of ordination by a spiritual entity such as God towards that. And that's a really powerful sense of entitlement and agency
Mm-hmm.
that gets cooked into a culture where we have statements like, pulling yourself up by your bootstraps. And there's this awareness that you can do it. In fact, you should do it. And in fact, you're supposed to do it. And I think that this culturally is baked in so deeply that it's beneficial to reflect sometimes on where this happened and to look to some of these religious origins that can influence cultures that impact us day in and day out.
Yeah. If I could add back onto that, um, this colonial moment, right, where folks come over to a land that is already occupied, and through exceptionalism that's then reinforced uh, by racism that was developed for specifically this purpose, right? Um, this this seizure of land, right, by people that then now really have no tie to the land historically, um, I think distances us from understanding how much the Christian and Jewish tradition are rooted in land and in place. And I think that ends up having ramifications with how we deal with an issue like homelessness, that is fundamentally about who gets to live where, and our relationship to land ownership and land stewardship and housing,
Mm-hmm.
and what houses and what types of homes exist where. It's very easy for us to over spiritualize that when the
Mm-hmm.
Bible talks about home or land, because we are fundamentally a people who don't have a connection to the land that we currently occupy that's more than a few hundred years old, and the relationship is not one of rootedness. It is one of seizure.
Mm-hmm. Thanks for that. Yeah, and so we have this development over really hundreds of years of people of a tradition where grace has been an incumbent and originating concept in this tradition. Yet we also have these seductive powers that people have succumbed to of colonization. And we see that played out in development over time of a normalization of what you in your book called a merit-based system. And if we want to, very fast forward to today, and if we want to bring this kind of these tides that we're talking about into expression of homeless services, you look at the landscape of offerings for homeless services, and you're able to identify when people are encountering services that are merit-based. And you show data that these systems that are based around merit and around accomplishing certain benchmarks to achieve even more benefit of services, that they don't actually cause, they're not actually helpful for the people that they're intended to serve. And that I think to some people is a great, I witnessed this when I've encountered this through the book with other people. Some people are very surprised by that this just doesn't seem to work. And you give us the data to show us that.
Yeah, so since the book came out, I often do workshops, right? And this is how I always conclude the slide where I talk about the merit-based model, the staircase treatment first model is.
Treatment first. Okay.
I talk a lot about the things that I don't like about it, and the ways that I think it subverts dignity, and the ways that it asks people to, give Herculean efforts without actually having the resources in order to do that. But I always end that slide by saying the one thing that we don't talk enough about with this system is that it doesn't work, right? And even if it didn't have all those other things going on with it that cut to the core of like what my values are on how we should treat each other, it doesn't even have the benefit of, all's well that ends well, because it's but what it does do is it reinforces the mindset that precludes it, right? Because if you fundamentally believe that people who are experiencing homelessness that there's something wrong with them, and then you put them in a merit-based model and it doesn't work, you can say it's because there's something wrong with them, right? It's a self-fulfilling system where you can look at the person and say that the person failed the program instead of realizing that the program is failing the person.
Yeah. And today, one of the aspects of this, and because what you're talking about is a general system of a merit-based system, and some of those expressions could be through, how you achieve permission to be in a housing situation. It could be through if you qualify for a job training program. There's a variety of ways in the homeless services sector that you could experience inclusion or exclusion through a merit-based, protocol. One thing I wanted to talk about today with you is harm reduction. And this would be in that spectrum of experiences that someone experiencing homelessness could encounter. And I was wondering if you could just tell us about harm reduction as a concept, and then I'd like to talk with you about how you see this related to your inquiry about grace and what that is. But let's start by defining the term and really getting a sense of what this is.
Yeah, and I feel like we could talk for a whole hour just trying to define harm reduction too. Because when I was first introduced to it, what harm reduction meant was that we carry Narcan, right? So harm reduction is a methodology that most often is used to talk about substance use, alcohol consumption, and often safe sex practices, sort of born out of those communities. But really more broadly than that, it's an approach to to many social problems that says the first and most important thing that we can do is focus on reducing the harms that are associated with behavior or that come out of behavior rather than moralizing the behavior itself. And so in the substance use world, that means that this very black and white view that we've carried that if you are experiencing a substance use disorder, you just need to stop, or there's nothing that we can do for you. You have to quit cold turkey. You need to achieve a certain level of sobriety to prove that, you know, X, Y, and Z, right? It instead starts with what's the most important thing we can do right now to keep you safe. Sometimes that looks like making sure that Narcan is available and that people are trained on it. Sometimes it looks like there being clean needles for somebody that is going to inject their drugs, that they have a clean needle to do it with rather than using a dirty needle, right? With sex practices, instead of saying, just don't do it, you know, using and distributing and educating about condoms is a harm reduction practice, right? It assumes that behaviors are likely to continue and that people have choices and agency to engage in behaviors that they choose to engage in, and that there are still important public health and interpersonal things that we can do to keep people safe even within those choices.
And you say in your book, you say that there's these the stories of 180-degree turnarounds, like the people lift them up, you know, and if you hear, you know, commercials on the radio for, you know, certain social service providers, the stories you're going to hear are people who, you know, lifted themselves out of, you know, their addiction with the help of this organization. Now they're sober and they haven't, you know, they have a job, and all of the success trappings and markings that we, you know, through a privilege-based system kind of look to as validation that this person has actually, you know, deserved the services they've gotten, right? You say that these stories of these 180-degree turnarounds, they validate our desire for perfection and tidy endings.
Yeah.
You say that even if we would rarely hold ourselves accountable to the same standards, which I'm laughing out loud because, I mean, true. This perfectionist mindset is the foundation on which we built most of our addiction treatment. And that then you go on to say, I want to suggest, however, this overemphasis on sobriety may have unintended consequences. Yeah, could you speak to that?
Yeah. So, you know, I think that we've all heard the stories, right, of person who's, you know, was addicted to drugs and gave their life to Jesus and never touched him again, you know, and I'm not knocking those stories or even casting doubt on them, except to say I've met hundreds of people that tried the same thing and that didn't work for them. Right. And I don't remember if I say this in the book, but I was at a training where somebody really poignantly said, you know, AA and NA and 12 steps work for a lot of people, but I think that in homeless services, we end up working with all the people that didn't work for. Right. And so the unintended consequences that I refer to are the sort of belief that because one treatment model works for some people and produces these amazing results, that anyone who it doesn't work for, again, like the merit-based programs, that there's something wrong with you rather than this treatment plan didn't work for you. And I think I tell the story about my dad being diagnosed with high blood pressure and how his doctor, if they put him on one medicine and it didn't work, wouldn't then say, what's wrong with you? They would say, well, maybe we should try something else. Even if some of the choices that my dad was making made it harder for the medicine to work, right? That's not how we approach most issues. And that's not just health issues, but all kinds of things. We don't just say, oh, we tried this one thing and it didn't work, so something's wrong with you. But that's what we do with addiction, and we hold sobriety as this gold standard, when for a lot of people it doesn't work, and there's a lot of reasonable reasons that it doesn't work.
I want to name, you were talking about how sometimes when we have these merit-based systems, we get trapped into the system itself, and there's no other way to express imagination within them. And you have a quote that again connects with some of the ways that cultures from the tradition of Christianity have impacted public policy in a way that is harmful for actually those who are suffering from substance use addiction. You say, we have for a century built our Christian philosophy of addiction on theological ideas that corner us into moralizing drugs and the people who use them to such an extent that the only available response is judgment and punishment. I read that and I experience two things. I experience that as being true, and I also feel a lot of sadness at that when I hear that.
Yeah, I felt a lot of sadness writing it. Because I think that what Christian faith, and maybe more poignantly church community, can offer has a lot to offer people who are struggling with that, and who want to change their relationship to the substances that they consume, but similarly feel cornered that they face choices and ultimatums that not only to relapse in a system like that causes the harms that they're trying to avoid, or feels like it gets them back to square one, but also also means exclusion from the thing, from community and from relationships that may be the only thing you have, right? It becomes all or nothing, not just with sobriety and drug use, but your entire safety net is contingent upon this thing that feels wildly outside of your control, or at least subject to things that are beyond your control, which then has the ironic effect of then causing you anxiety, which then drives you back to the thing that relieves your anxiety, right? And ends up being just this vicious cycle where, I know that if I start drinking again, that everything's going to come crashing down. But there are days when all I do is think about when my next drink is going to come from, and oh my gosh, there's no way I'm ever going to make it. I'm going to blow it. And when I blow it, I'm going to lose everything. And it's just, it becomes a spiral that leads back to the drink. Right.
Yeah. Let me ask you a question. So you're talking about, so you're a practitioner. I mean, you're in homeless services. You're doing the work with people. So some of the people that I work with are not in homeless services. They're not doing this. But what could you offer to someone who's not a practitioner, who's not working in, directly with populations experiencing homelessness? How can someone develop a mindset as they see a human being that might be suffering from substance use addiction? How could you develop a harm reduction mindset, a way of looking, of perceiving another human being, even if you're not doing work that's in practice, of harm reduction? Yeah. Does that make sense?
Yeah, definitely. I mean, I think one of the most important things is to subvert the mindset that their substance use is the defining attribute of who they are in their life, right? And it's not to minimize it, right? And it's not to say that, that may not be something that they need to address, right? But I think that there is this narrative that, like, if you are in active substance use, and so we tend to think that if somebody is in active use, that it's like we treat them as if they've suddenly become zombies, right? That they have no free thought, that they have no agency, that they have no choices, that they've suddenly become this like other type of human that we can no longer relate to or converse with, and it's just not true. To the extent that we basically treat them as though until they've gotten on the other side of that, there's just absolutely nothing that we can do for them. And I think subverting that mindset is so important, that actually somebody with an active substance use disorder is somebody that you can have a conversation with, that you can have a meaningful conversation with, who can experience a life-changing moment, or who can make a choice to better themselves, even if that choice isn't, I'm going to stop using drugs forever today, right? That these are folks who are participating in life, and that we can come alongside, rather than you're not relevant, or you're not worthy, or it's not even possible to do something until you get out of this thing.
You name some of the attributes of harm reduction being, for people who are experiencing substance use and addiction, some of the attributes being, the central attributes being choice, autonomy, and safety. Choice, autonomy, and safety. And it's fascinating that there are perspectives, sometimes unexamined perspectives, that feel that a human might not even be worthy of safety if they choose to continue. That might not even be trusted to have autonomy, and that might not be capable of having a choice. This is the degree to which we can create a person who's not actually a human. And it's a real danger. And so one of the ways that I've seen harm reduction humanize people, this is through some of the principles and strategies that Interfaith Works implements, is this way of being with someone where you offer them autonomy, you offer them agency. It's a way of empowering them. And you actually point to data that says that this works, this model works, even if it might challenge people with some of their unexamined biases towards this merit-based system. It actually works, is what you're saying.
Yeah, and it's an important point to make, because the goal of harm reduction still isn't sobriety, right? Like, and I think that that's important to name. But it does have that result a lot, and to a success rate that bears understanding more. And the perfect example of that is safe consumption sites. This is something that exists in other countries, but only a couple of them exist in the United States because they're largely outlawed. There's sites where people can come and bring their drugs with them, have their drugs tested, safely use those drugs under medical supervision, and then leave and go on about their day without punishment. And while it's not necessarily the stated goal of these sites to do this, the stated goal is to keep people alive, right? Instead of overdosing or experiencing any of the harms associated with drug use that often happens in private. But folks who come to these safe consumption sites continually seek out resources to change their relationship to those substances, right?
Yeah.
So the result ends up coming not because we're trying to force it upon people, but because we meet people where they're at with what they need in the moment. And then when they want to make a change to that relationship they have with the substances, they trust those professionals who have been trusting them to help them make that change.
Thanks for naming that too. And because I think when I talk about the outcomes and efficacy and that it's working too, one of the things that you point to in your book are, does this model that someone's coming toward, whether it's a merit-based system or a harm reduction system, does it build community for them? Are they experiencing connection with other people that's meaningful? Are they experiencing respect? And those kinds of phenomenon are what empower the human. I can think of experiences in my own life where, building community, connection, and respect were what helped me to make the next best decision for my life. And so I think that's an attribute. Those are attributes of this model that you're talking about.
Yeah, absolutely.
Yeah, and I have the privilege of standing, shoulder to shoulder with the people at Interfaith Works who are doing that work and seeing them and how their commitment to the qualities of offering unconditional positive regard, for people that are in our caring relationship, and having the burden of respect being always on staff. It's always the burden of respect is always on staff, regardless of the circumstances. And I think these are powerful extensions of the harm reduction model, because they enforce that basic premise of autonomy and choice and safety, respect. Yeah. Yeah. Kevin, you talk about drugs being something that are effective for people. They work, is what you say. People use drugs because they work. And I've had 2 cups of coffee today, and I drank them because I believed that they were going to give me a certain, power in the day, and perhaps they have, but I recognized your honesty with that. And I also want to ask you how people could understand that statement with the concept like harm reduction.
Yeah.
How do they live together, those statements?
Yeah. It's just so important, right? Because one, it speaks to having a better understanding of why people use substances in our very basic, DARE program type mentality. We just think drugs are a bad choice that bad people make, right? Rather than drugs serve a purpose, they fulfill a need that people have, and whether the perception is true or not, they perceive that the only way that they can fill that need, or the best way that they can fill that need, is through taking that substance, right? And I think it's helpful to know that the main substances that we talk about, whether they're opioids or amphetamines, are medicines that we use medicinally to treat things, right? So opioids, whether you're talking about heroin or fentanyl or Percocet, right, they're all the same class of drugs that are, apart from heroin, used medicinally in hospitals as part of treatment plans to manage pain. So when we have an opioid crisis, what we have is a crisis of people who are using something to manage pain. We are just kind of predisposed to being judgmental towards what type of pain and in what types of context that should be okay, and to what extent we as a society have deemed it is okay. The other example being, methamphetamines have the same basic chemical structure as Adderall, right? Which has the effect for people with ADHD to help them regulate, right? What we understand amongst people who use methamphetamines habitually is that they are people that are seeking energy, or they're seeking some kind of regulation that maybe the chemical makeup of their brain is not producing for them, or that the methamphetamine causes a reaction that benefits them. And the example I use in the book is that meth is a great way to stay awake all night, even though you're tired. And the reason you might want to stay awake all night if you're experiencing homelessness is to make sure that nobody steals your stuff, that nobody comes in your tent, to make sure that nothing bad happens to you when you're in an unsafe space. And it also makes you feel really powerful and really in control, right? Which is a feeling that somebody who might feel very powerless or like life is happening to them rather than something that they are managing, that can give them a feeling that gives them something, right? And so understanding what it is that these drugs are doing for people and what absence might be notable that drug is filling, rather than just saying, oh, they're using a substance that makes them feel good because they're bad people who are seeking hedonist pleasure, right? Like that's the easy cop out, rather than actually asking, why is this person doing this thing? What need might it be filling? What is this accomplishing for them? That maybe there is a better thing that can accomplish that for them, but maybe they don't have access to that. Maybe they don't know about it. Maybe they don't have the tools to fill that need that we all have, that I fill in this way, but they can only fill in this way.
Yeah. I so appreciate you, just the way that you reside in the nuance and the subtleties of the complexities of the lives of the people you're intersecting with, and the sense of honor that you're bringing to the ways that we find ourselves in the life that we're living. I just recognize that in you, and thank you, and name that as an attribute in your work that is, I'm sure, of service to everyone you encounter. So thank you for bringing that to what you do. We're going to begin to transition out of this podcast now, but before I ask you the final question, Kevin, I just want to, again, just hold up this book here. There we go. Grace Can Lead Us Home by Kevin Nye. We'll link to it. For those people who stand in the tradition of Christianity or those who do not, this is a way for you to understand some of the ways that some of the prevailing cultures of our society have been formed by this particular religious tradition, and the way that they impact outcomes of perception and policy for people experiencing homelessness in a real way. It's also a chance to get to know a person like Kevin, who's done extensive theological training, and to see them in through the public witness of this book, to see them wrestle with the tradition, and to see how they've experienced best practices that sometimes are in tension with some of the cultures that we've inherited, that Kevin and I discussed earlier in the book. So thank you for writing the book. We wish you the best with your follow-up book, and I'll give you the chance to close us with the final question that I ask every guest on this show. We want to ask you how you define hope, and where are you seeing or experiencing hope today?
I so love that, and part of the reason that I love that is that hope is in the title of my new book.
You just revealed it.
I know. I revealed one word.
One word.
And when I came to realize, this is a book about hope, it just felt so right. And part of that is because my definition for hope includes things like lament, and includes things like rage. And I take my cue on that from Cole Arthur Riley in her book, This Here Flesh, which is maybe the best spiritual text I've ever read in my life. She has a chapter on lament where she says, and I'm gonna get it slightly wrong, but she says that lament is not anti-hope, essentially because if you are lamenting, it means that you see the world as it is, and believe that it could be better, right? And your lament is the difference between what the world is and what you hope for. And so the season that I'm in, I get a lot of hope from a lot of things, but I also I take a moment to remember that when I'm angry at something that's going on in the world, or I'm frustrated at an organization that isn't holding values that I think that they should have, even that is an act of hope because it doesn't concede. It doesn't say, that's just the way it is. That's the way it's going to be. Whatever. It doesn't surrender. It says, no, we can do better. We're capable of better. And I'm going to feel whatever feelings come from the belief that we ought to be there and we can get there. So wow. that to me is what hope is looking like these days.
Well, thank you so much for that. I really appreciate that. And I wrote down the title of that text that you referenced to. I'll check that out, and then I'll email you and let you know if I get around to reading it. So thank you, Kevin, for being with us today. Thanks to you, Micah, your son right there. Hi, buddy. All right. You did great. Appreciate you, Kevin. Appreciate your ongoing good work, and we'll be in touch with you to stay in touch as organizations doing similar work in different parts of the country. So again, thanks to our guest today, author Kevin Nye, for joining us in this episode of Lean In Olympia. And again, you can find past episodes of Lean In Olympia on our YouTube channel, Spotify, and Apple Podcasts. Yeah. And don't forget to subscribe so you never miss a new episode. And you can check out past episodes on our website at interfaith-works.org. So thank you very much, all of you, for being here today, and have a great rest of your day.